Good morning. Thank you all for joining us. I'm sorry for the little bit of a delayed start. Welcome to Senate Finance. I am Senator Marilyn Dondero Loop, and I'll be chairing the meeting today. We do have an overflow room if you need a place to sit right next door. And with that, I will ask the secretary to please call the roll.
Senator Buck, Senator Cannizzaro, Senator Neal, Senator Nguyen, Senator Stone, Senator Taylor, Senator Titus, and Chair Dondero Loop.
And I am here. Thank you very much. And with that, I believe all our committee members are here. Thank you. We'll start by reminding everyone to please mute their electronic devices. And if you're going to make any comment, please make sure you state and spell your name for the record. Please remember also we are only talking about the financial part of a bill, so please keep your presentations short and to the point. I don't want to have to tell anybody to be quick and be gone. So with that, we will start with Senate Bill 434, which is Senator Cannizzaro. Creates a program to award grants to address shortages of providers of health care. And when you are ready, Majority Leader, you may begin.
Thank you, Madam Chair and members of the committee. My name is Nicole Cannizzaro, and I serve as a senator from Senate District 6 in the northwest portion of the Las Vegas Valley, and also as your Senate Majority Leader. And I am very proud today to be presenting to this committee Senate Bill 434, which creates a program to award grants to address shortages of providers of health care. This particular bill we are referring to as Centers for Medical Excellence, or CME for short. And what this bill seeks to do is to introduce the statewide healthcare access and recruitment grant program to provide financial incentives for healthcare access and healthcare workforce expansion. As currently drafted, Senate Bill 434 does contain a $50 million general fund appropriation to help with establishment of Centers for Medical Excellence. And in future biennia, the grant program would be funded with a transfer of 0.5% of the total anticipated revenues for the state general fund. There is a proposed amendment, Madam Chair, which we have been working on since this bill was first heard in the Policy Committee, and which will be of interest to this committee for financial purposes. That proposed amendment should be available to you on Nellis. Members of the committee should have a copy of this proposed language. This amendment would remove that $50 million general fund appropriation and instead allow, with approval from the interim finance committee, so that there still is legislative oversight involved, for transfers of surplus prescription drug rebate monies in an amount not to exceed $25 million each fiscal year. And so with this proposed amendment, there is a potential funding mechanism, but is provided when there is monies available, and obviously is limited per fiscal year for the committee's consideration. Senate Bill 434 does represent a significant step, I believe, towards strengthening Nevada's healthcare workforce and for allowing us to seek to bring to this state other places that have much more specialized medical care. And I know this is not the Policy Committee, so I will not delve too much into that unless members of the committee have questions. But with that, Madam Chair, and the conceptual amendment, I would be happy to take any questions that you or the committee members may have.
Thank you very much. And are there any questions from the committee? Well, while we're waiting for people to process, I know this isn't a policy committee, but would you repeat the last part about your amendment and how that will actually work?
Yes, thank you, Madam Chair. Nicole Cannizzaro, Senate District 6, to you, Madam Chair. The way in which the amendment would work is that for for no later than June 30th of every fiscal year. The state could utilize, obviously with IFC approval, so the members ostensibly of this committee that make up the interim finance committee would still have oversight capabilities, which is present in the language of the bill to award these grants regardless. But we could seek to have the director in HHS request for a transfer of no more than $25 million for each fiscal year from the state's prescription drug rebate program in order to fund this particular program, and then thereafter there is a mechanism to allow for some transfers based on state revenues. And then within the bill, there are also structures that would allow for different medical centers that are bringing in and serving populations in areas of our state or providing healthcare access that we don't have here to be able to come in and utilize those funds to help with build out and establishment of those programs or of those centers.
Okay, thank you very much for that explanation. Senator Titus.
Thank you, Madam Chair. I certainly appreciate, Majority Leader, that you're bringing bills to hopefully solve some solutions for our healthcare access. I need some clarification on the expectation of the monies on that prescription drug rebate program, and what is the average amount that we usually have left over to be available to use on that, and is it taken away from other programs, number one? Number two, how much do we get? Number three, is it going to be able to be used because it's so volatile in what we make on those? Are we looking that if we don't have the 25 million, we need another source, or is that just where we would be? Thank you.
Thank you for the question, Senator Titus. Through you, Madam Chair, to Senator Titus, Nicole Cannizzaro, Senate District 6. So that's a great question. I think that there is legislation this legislative session that I am certainly hopeful will pass that would lend itself to allowing the state to collect in excess of, we believe, $100 million in surplus prescription drug rebate monies. Obviously, I think to your point, so I think to the first part of your question, which is there money that would be available in that account? I believe that there is a pathway to do that, which is why we've sort of identified this as a potential place to find some of those monies over the $50 million general fund appropriation that was in the original bill. I think also that the way that this language is written does not require us to transfer that $25 million. Obviously, it would be dependent upon the director coming and requesting for that transfer to happen. There's obviously parameters that we tried to put around this so that it was only up to that $25 million in each fiscal year. And certainly within the parameters of the bill, there are mechanisms to make sure that there's not just an outsized amount of money just sitting in that account. And so I think with all of those mechanisms, we've tried to be pretty fiscally responsible about making sure that if we have monies available, we can allocate them, allowing legislative oversight in that process, and then making sure that there's not just a whole bunch of money that keeps accumulating in this account that's never going out to any of these potential grants.
Thank you for that. And then just for clarity, the other content of the bill where we're using a percent of the rainy day fund would continue as originally presented. And then one of the things we worry about, say, for example, in our GME funding where we've given monies into there and then it's never allocated. So these would not be reverted back to the general fund. These would then stay in this account. At some point, we'd review where those funds are.
Yes, that's an excellent question. Through you, Madam Chair, to Senator Titus, Nicole Cannizzaro, Senate District 6. So within the bill, the other language that's not in the conceptual amendment, but is in the bill in Section 8, subsection 4, there is language that provides that if the balance of the account is greater than $60 million on July 1st of a fiscal year, the state controller shall not make a transfer pursuant to subsection 2. So we've tried to place, like I said, parameters to make sure that we are not doing that we're not sending in a whole bunch of money and continuing to do transfers if this grant program is not working. And so I think that was one of the considerations because we've seen that happen where monies go in. We think they're going to really do a great thing in the next biennium, and then we come back in the next legislative session and none of that money has been used. And then we figure out that there are other things that we need to do to rectify that. I think we tried to build in that on the front end here to make sure that we're not just accumulating a bunch of extra money that's sitting there unused, but to put in enough that I think will incentivize some of these different providers to come to Nevada.
Thank you, Madam Chair. I certainly like the approach.
And thank you very much. Additional questions or comments? Senator Neal? All right. With that, thank you very much. If you'd step back. If there is anyone here in support of Senate Bill 434, if you would like to come forward, and please remember to state and spell your name for the record. And please go ahead, start when you're ready.
Good morning, Chair and members of the committee. My name is Charlie De La Paz, CharlieDelapaz, and I'm here on behalf of the Nevada Nurses Association in support of SB 434 and the proposed amendment. This bill is a smart investment in Nevada's health infrastructure, and using surplus prescription drug rebates to fund it is both fiscally responsible and morally sound in order to address our nursing shortage in particular. We urge your support. Thank you.
Good morning, Chair and members of the committee. Sheila Bray with the University of Nevada, Reno. We are here in full support. We actually co-presented this bill in Senate Health and Human Services in the education part of the bill, the policy part, through our Office of Statewide Initiatives with UNR Med, and just really provided some good details on the amount of workforce shortages in these areas. And we think this bill is creative and will go a long ways to supporting our workforce. Thank you.
Good morning, Madam Chair, Madam Vice Chair, members of the committee. My name is Drianna Dimatulak. That's DriannaDimatulac. I'm with Brownstein today representing the Immigrant Home Foundation in strong support of SB 434. We'd like to first thank the Majority Leader for bringing forward this vital and innovative piece of legislation, which addresses one of Nevada's most pressing challenges, the shortage of healthcare providers. SB 434 would provide essential grants to programs that help close this gap, such as the Immigrant Home Foundation's in-house psychological services program. Through this initiative, we've been able to offer trauma-informed therapy and psychological evaluations to survivors of domestic violence and other serious crimes. SB 434 would give us an opportunity to apply for funding so we can continue providing critical health care to some of our state's most vulnerable residents. For these reasons, we respectfully urge your support. Thank you so much.
Good morning, Madam Chair and members of the committee. Allison Herzik, last name spelled Herzik, Director of Nevada Government Relations for Dignity Health St. Rose Dominican. We're in support. Thank you.
Good morning, Chair Don Darlup and members of the committee. For the record, Leonardo Benavides, spelled Benavides, here on behalf of UNLV, here strongly in support of SB 434. Thank you.
Good morning, Chair Don Darlup, members of the committee. Joanna Jacob on behalf of Clark County in support of SB 434, as we did in the policy committee. And with the amendment, healthcare provider shortages have impacted our programming, especially in child welfare and the kids that we serve. So we are in support of any efforts to help address this issue. Thank you.
Good morning, Madam Chair, members of the committee. Leah Cartwright, LEACARTWRIGHT, here today on behalf of the Nevada Public Health Association and the Nevada Primary Care Association. The Nevada Primary Care Association represents the federally qualified health centers in our state. Those are the safety net clinics that provide care when no one else can or can afford it. They are in full support. Thank you.
All right, seeing no more additional support here in Crescent City, we'll go to Las Vegas. Is there anyone in Las Vegas? Seeing no one coming to the table, AVH, we'll go to the phone lines.
Thank you, Chair. If you would like to testify in support of SB 434, please press star 9 to take your place in the queue. Caller with the last digit 770, please press star 6 to unmute yourself and begin.
Varela, spelled V. Hi, my name is Victoria Varela, spelled Varela. I'm a community member with a 2-year-old with a cleft palate, and the program has been very helpful. I think having a streamlined team, a full team on board would be really helpful for us to receive more support, more services. We do receive a lot of really long waits, up to a year, to receive services. So I think any funds that you can allocate to help with that wait and with more providers would be really helpful. Thank you.
Thank you, and I believe that was support for Senate Bill 280 coming up. AVH, is there anyone else on the line?
Thank you, Chair. There are no other callers to provide support testimony at this time.
Okay, thank you very much. Then we'll move to opposition. Is there anyone here in the room in Carson City in opposition? Not seeing any. Down in Las Vegas? Not seeing any. AVH, we'll go to the phone lines. Anyone in opposition?
Thank you. If you would like to testify in opposition to SB 434, please press star 9 to take your place in the queue. There are no callers wishing to offer opposition testimony at this time.
Thank you very much, and we'll go to neutral here in Carson City, in Las Vegas, on the phone lines. AVH, when you're ready.
Thank you. If you would like to testify in the neutral position for SP 434, please press star 9 to take your place in the queue. Caller with the last 3 digits, 225, please press star 6 to unmute yourself.
Good morning, members of the committee and chair. Katrin Ivanov, IVANO Frank. I am in support of this bill. Can I speak? I wasn't able to click on time. Hello?
Yes, please go ahead.
Okay. I'm in support of this bill because we do have a lot of shortage and we do have to attract more health workers. The only thing, I don't know if it's in the bill, is how do we know that we can keep them longer after they get the money and stuff like that. But thank you for trying to come up with ways to attract people. Thank you and have a lovely day.
Thank you very much. AVH, do we have any other callers in neutral?
Thank you. If you have recently joined us and would like to testify in the neutral position for SB 434, please press star 9 to take your place in the queue. There are no further callers wishing to offer neutral testimony at this time.
Thank you very much. Senator Canizaro, any closing words? All righty. With that, we will close the hearing on Senate Bill 434, and we'll open the hearing on Senate Bill 280, and we'll welcome Senator Wynn to the table. And please go ahead when you're ready.
Thank you, Chair. And with me, I also have down south Dean James Ma, and I have Dr. Fan Nguyen and Dr. Jesse Falk. So if they can come to the table very briefly right now, that would be great. I have reminded them to be very brief. My name is Rochelle Nguyen. I proudly represent Senate District 3. And this bill, short end of the story, and I will turn it over to them for their brief presentation, is the NEIS Craniofacial Team is the sole provider of such services in Nevada. It closed in 2020 due to defunding during the COVID. Unfortunately, we as a legislature were not made really aware that we did not refund this program. So currently, Nevada and Alaska are now the only states without an accredited team. This allocation provides for the appropriate support to reestablish a program that qualifies under the American Cleft Palate Craniofacial Association. And with that, I will turn this over to Dr. Falk and Dr. Ma. Go ahead and begin when you're ready.
Good morning, Senator Nguyen, Chair and committee members. I'm Dr. Jesse Falk, Jesse-Falk, a board-certified oral maxillofacial surgeon in Las Vegas. Now, given the kind of legislative battles you face on a regular basis, budget cuts, taxes, and unusual political wrangling, SB 280 is refreshingly straightforward. This bill provides $2.9 million to reestablish a dedicated cleft craniofacial medical team at UNLV School of Dental Medicine in partnership with UNLV School of Medicine and Roseman University. The funding will support a clinic to deliver essential care, including access to surgery, orthodontics, speech therapy, and many ongoing medical services for children dealing with cleft and craniofacial conditions. Elementary school isn't easy for any kid, let alone navigating life with cleft lip and palate. The challenges go far beyond appearance. They affect speech, health, and confidence. Without one central clinic, it makes it difficult for families to navigate their child's many appointments and ongoing needs. SB 280 changes that, dramatically improving access and consolidating care into one central location, thereby transforming the lives of countless children in Nevada. You all have a really an opportunity here to make life-altering changes for these kids, and we're generally excited to work with all of you to make it happen. Thank you.
Good morning, Madam Chairman, Senator Nguyen. Thank you for providing me the opportunity to testify. My name is James Ma, J-A-M-E-S-M-A-H. I serve as the Dean at UNLV School of Dental Medicine. I'm here to make 3 points here. Number one, the incidence of cleft palate is 1 in 500 live births, and with 40,000 live births in Nevada every year, approximately 57 children are born with cleft lip or palate. These children require a lifetime of care. It costs over $100,000, and typically 4 to 6 surgeries and numerous post-op and other visits are involved in the care of these individuals. The second point I want to make is that UNLV School of Dental Medicine has been fortunate in the sense that we have a federal grant, and we just built out a special needs clinic where this clinic and the team could be housed. The third thing is we need to look ahead at future generations. We are the sole dental school in the state, and one of our objectives is to train individuals, the residents that will then learn from these experiences and become the competent, skilled professionals and the next generation of care providers for individuals in this state with cleft palate and craniofacial anomalies. Thank you.
I'll just point out that this has been a really great working opportunity to work between the UNLV Dental School and the UNLV Medical School. I think what was most telling to me is that we have our children that are being sent out of state and put on waiting lists that are sometimes upwards of 3 to 5 years. And in this area, one thing I've learned is that when you can take care of, have these surgeries and have them earlier on, these kids have more fulfilling lives. They have less surgeries to deal with as they take care of it later on in life. The one thing that I also appreciated about this is we fortunately have a building and we have an ability to handle these things already within existing things. So I'm not coming here asking for additional capital programs to be able to find a place to house this program. I think it was an oversight when we didn't refund it after the cuts that we made during the 2020 legislative special sessions. And I think this is unfortunately a great opportunity to be able to do so now. So with that, I did stand where any questions you might have.
Thank you so much, Senator Nguyen. Questions? Senator Stone.
Thank you, Madam Chair, and thank you for bringing this project back again. Would this be considered just one shot to get the program back on its feet, or do you see that there's going to be some sustaining funding over future biennia?
I think anytime you bring an appropriation bill, it is at one shot. My hope would be that UNLV and she would include this going forward as a part of their base funding allocation moving forward. I think we have a very organized team. I have encouraged people to put it in writing, and if you see on Nellis, we have a long list of dentists and doctors that support this project. So hopefully they all won't come up and testify in support. We've asked them to kind of consolidate their testimony to do that, but it does impact a lot of people, and hopefully it is a project that we will be able to continue, and we will see those results immediately from this collaborative effort at UNLV between the dental and medical school. And also Roseman University. I think we've been trying to do other partnerships amongst all higher education, both private and public, to make sure that we're able to get this off the ground and utilize all the resources in the community.
Additional questions? Senator Canizaro.
Thank you, Madam Chair. And you may have addressed this as I was reading through the bill during the presentation. How many other states currently have this program?
Right now, everyone but us and Alaska.
Great, thank you. Thank you for bringing the bill. Thank you, Madam Chair.
Thank you very much. And thank you, as always, when we discuss children, the one thing that is very consistent is the earlier the better. It doesn't matter if it's pre-K, cleft palates, anything that happens with kids, the earlier the better. So thank you very much for bringing this bill. And with that, I will ask you to step back, and we'll ask those in support to come forward here in Carson City. Go ahead when you're ready.
Good morning, Chair John Daraloop and members of the Senate Committee on Finance. For the record, Leonardo Benavides, Benavides, Director of State Government Affairs and Community Engagement with UNLV. Here in support of SB 280, we appreciate Dr. Dean James Ma work, and as well as Senator Rochelle Wynn for bringing this forward in order to restore funding for this very important program in order to provide this preventative care for our children. Thank you.
Thank you very much. Seeing no additional support here in Carson City, we'll go to Las Vegas. Please go ahead when you're ready and state and spell your name for the record.
Good morning, committee members. My name is Dr. Fan Nguyen. I have been involved with the Tzu Chi Buddhist Foundation since 2016. Each year, we organize free dental outreach to serve hundreds of underserved and uninsured patients in Las Vegas. We have root canal specialists, pediatric dentists, orthodontists, oral surgeons, and general dentists volunteer their time and training to serve the people of our city. Senator Rochelle Wynn, Assembly Member Ruben De Silva, Selena Torres, as well as Dr. Rebecca Edgeworth have seen it firsthand because she's actually volunteers as our physician. They've seen the unmet needs in our city and see what can be accomplished when we have multiple specialties in medicine and dentistry collaborate to help our community. SB 280 will bridge the gap of comprehensive specialty care for low-income young patients born with facial malformation and give them a chance to grow and live a normal life. I respectfully urge the committee to pass SB 280 and would like to thank Senator Rochelle Wynn, Assembly Members Ruben De Silva, Selena Torres, Zui Nguyen, and Rebecca Edgeworth for being strong advocates for patient care.
Good morning, committee members. My name's Lee Roundy, Leeroundy. I'm the program director for the Graduate Pediatric Dentistry Program at UNLV, and I'm here in strong support of the SB 280 bill. Thank you.
Thank you very much. Any additional support there in Las Vegas? Seeing none, we'll go to the phone lines. AVH, when you're ready.
Thank you. If you would like to offer testimony in support of SB 280, please press star 9 to take your place in the queue. Caller with the last three digits, 511. You are unmuted on our end. Are you muted on yours?
I'm unmuted. My name's Richard Cunningham, Cunningham. I am a parent of my son has a bilateral cleft palate. We were part of the craniofacial clinic, and it is a valuable resource for parents who have children who get overwhelmed with everything, and it can definitely have a support for SB 280. Thank you.
Thank you. Next caller, please.
Caller with the last three digits, 964. You are unmuted on our end. Are you muted on yours?
Yes.
Go ahead, please.
Good morning. Thank you for the opportunity to speak with you. My name is Luis Silva, Luizsilva, and I'm here as a parent and as someone who's seen firsthand the urgent need for a dedicated cleft and craniofacial clinic in Nevada. My child was born with a cleft lip and palate, a condition that requires care from a wide range of specialists, surgeons, speech therapists, audiologists, orthodontists, and more. When we began seeking treatment, we were quickly overwhelmed by the reality of the healthcare landscape in Nevada. Each specialty had a long wait list. Some appointments were scheduled months out. And each visit requires travel across cities, sometimes repeatedly, to complete one piece of care, sometimes just for a 10-minute consultation. In our case, early intervention was critical. The first 3 months after birth are crucial to achieve the best possible outcome for children with this condition. Early coordinated care can make a lifelong difference. Fortunately, and only thanks to personal efforts of dedicated doctors who intervene on our behalf, we're able to get appointments expedited, but not every family is that lucky, and no family should rely on that kind of lucky. Without those interventions, our child prognosis would have been significantly worse. We need a single place where children with cleft and craniofacial conditions can receive comprehensive, personalized, team-based care without months of waiting and endless driving. Funding this clinic isn't just about medical logistics. It's about giving children the best possible start in life. It's about relieving families of a huge emotional and financial burden. And it's about keeping Nevada families in Nevada for their care instead of sending them out of state in desperation. It's an investment in a better health outcomes, in equity of care, and the future of our children. So I'm here to ask you as a citizen and as a parent to support the appropriation funds to make this clinic a reality, because no parent should have to fight this hard to get their children cared as they need, and no child should miss out on a better future because help wasn't available in time. Thank you for listening and considering.
Thank you very much. Next caller, please.
Caller with the last three digits, 420. Please press *6 to unmute yourself, and you may begin.
Good morning, ladies and gentlemen. I want to say thank you so much for the opportunity to voice my support for this bill, SB 280. My name is Christopher Trin, last name spelled Trinh, first name Phristopher. I'm a general dentist and a part-time clinical faculty at UNLV Dental School. I have been involved with many free dental outreach within our community. I want to thank all those who have been involved with this project and this bill. Much appreciated. This definitely will make a life-changing for all those kids. Thank you again. Have a great day.
Thank you. Next caller, please.
Good morning, Madam Chair Lady. My name is Darren Caldwell, Caldwell. I'm speaking as a parent of an 11-year-old son who was born with a cleft palate. If it was not for the help of the Roseman University and everyone else involved with the facial clinic, we would have been lost trying to get him the services and the help he needed. I believe this is very much needed because also a lot of parents have to travel across the city to different places, which some have no form of transportation to get there. With one solid place being able to help everyone, it would be a lot better, and it's something that's really needed, is what I believe. Thank you.
Thank you. Thank you. Next caller, please.
Caller with the last three digits 972. Please press *6 to unmute yourself and you may begin.
Hello, my name is Stephanie Martinez. I am a first-time mother of my son who was born with bilateral cleft lip and palate. I believe this bill is extremely important to find support for any family members who have kids with this diagnosis. It is important for us to stay within Nevada and be able to provide the proper care for our kids instead of going to another state. I do ask for you to support this bill S2P80, as I am currently seeing a lot of different specialists in different areas. So I really hope we are able to pass this bill in order for us to provide the comfort and support for all the children and for all the families out there. Thank you.
Thank you very much. Next caller, please.
Hi, my name is Victoria Varela, Victoria Varela, and I'm calling in support of SB 280. My daughter was born with a cleft palate, and we are a patient at Roseman University, and they've been a great support for us for all of her orthodontic needs, but her other needs, such as, her ears, her speech therapy, all of her other appointments and services that we're going to need along the way. It would be a lot easier if we had one clinic for her to go to where we could receive kind of streamlined services for her as we're driving from East Vegas to Henderson to North Vegas, and the appointments are very far out, especially, for her ears, and we're really struggling to get services for speech therapy. We're in some right now through the hospital that end in December, and we've got on a wait list already because we know, December will quickly be here, but we're still going to be 6 months out past that, and she's going to be behind in her speech. She's going to have surgeries, and it's difficult to find the services in Las Vegas in the first place, but then to get on a wait list and wait for so long, and she just has to kind of be complacent at the time, and she's very young, and the sooner the better. So we are in support of this bill. We're hoping that this will kind of fill in the gaps of the services that we have in Las Vegas and in the state. That way we can keep our care here, keep it streamlined, and make sure that she's receiving everything that she deserves and that she really needs to be able to grow and keep up with the other children around her. So we're calling in support of this. Thank you so much.
Thank you very much. AVH, next caller, please.
My name is Alice Chen, and I am a board-certified pediatric dentist who has practiced in Las Vegas for 17 years.
I am speaking today as Nevada's public policy advocate representing the American Academy of Pediatric Dentistry, as well as the Nevada Association of Pediatric Dentistry. On behalf of Southern Nevada children with craniofacial anomalies, I want to thank Senator Rochelle Wynn for introducing SB 280 this legislative session. Passage of this bill will increase access to care and ease many existing burdens on these families. As an organization, the pediatric dentists in Nevada voice our strong support for the establishment of a craniofacial team, which aligns with our belief of providing a team-based interdisciplinary approach that is crucial for the care of these children and their families. I would like to conclude my statement with a letter that a cleft patient mom has entrusted me to share with the Senate. My name is Tiffany Gnu. I am a 43-year-old Army veteran. I have lived in Las Vegas for 12 years. My son Harrison was born with a bilateral cleft lip and palate. He also has von Willebrand's disease. He has so many different doctors all over Las Vegas. I would do anything for my son, and that includes driving all over to see his doctors right now, as he will be having a bone graft surgery soon. Having a centralized location for all his doctors will be a lot easier on me, but more importantly, better for my son. To be able to see all his doctors in one day would be amazing. Having a team to meet with once a year to talk about next steps and what to expect will be even more amazing. Visiting Dr. Menezes, Dr. Moxley, Dr. Roberson, Dr. Chen, Dr. Ford, and his pediatrician at Nellis Air Force Base, preparing for Harrison's surgery is a lot, and I have to take time off of work to bring him to all these appointments. Please consider all this when making a decision. Having a team approach will not only be better for Harrison, but for all cleft children in Southern Nevada. Very respectfully, Tiffany Gnu. Thank you for your time and consideration.
Thank you very much. Next caller, please.
I timed it yesterday.
AVH, do we have any more callers in support?
Yes, Chair. One moment, please.
Hello, good morning. Am I on?
Yes, you are.
Hi, my name is Jennifer Cunningham. I represent my husband here, Richard Cunningham, and our last name is spelled Cunningham. Our son is 9 years old, bilateral cleft lip and palate. He has been through the craniofacial clinic, and I can tell you firsthand that the doctors were amazing. He was born in 2015. The craniofacial clinic provided a catch-all for services that we may have not been receiving, that we didn't know were available. With the little ones, I'm also a previous educator. The little ones, the more intense and the earlier the better. So we were on board with speech pathology coming to our home. We were on board with an orthodontist, Dr. Roberson. Everybody was there once a year to meet and greet us and to make sure that nothing was falling through the cracks, that all of Aaron's needs were being met. It's such a multifaceted approach when it comes to bilateral cleft lip and palate that the pediatricians are often unskilled in that area because it can be so different from child to child that the craniofacial clinic did provide us with a plan of attack, a checklist of checks and balances of where we need to be year by year. And it fell off the earth during the pandemic, and we were at a loss. But thankfully, we were always on top of it. I know I actually quit my job when Aaron was born to be on top of it and to get him to all of his appointments. A lot of parents can't do that. So we were always in touch with who we needed to be in touch with. But I can see, and I have seen kids through that pandemic period when there were no services available get lost, not receiving their speech like they should have been, not because, the team fell off the face of the earth. And a lot of parents need that one-on-one approach per year to stay on track. So we are in complete support of SB 280, and it's done wonderful things for our family, and I would love to see it come back and do wonderful things for other families here in Nevada. Thank you for your time.
Thank you very much. Next caller, please.
Zoom participant Stephanie, you are unmuted and may begin. Once more, Zoom participant Stephanie, you are unmuted and may begin your testimony. Since we are experiencing a technical difficulty with this caller, Chair, would you like to move on?
Please.
If you have recently joined us and would like to provide testimony in support of SB 280, please raise your hand in the Zoom client or press star 9 to take your place in the queue.
Hello, my name is Benjamin Caballero. I'm calling on behalf of my son, Amin Caballero. He was born in January 24th, 2017 with a cleft lip and bilateral palate. And he is one of the kids that was able to get into NEIS once he was born, very early in his life. And we are so incredibly grateful for NEIS because one of the main factors was there's just so many things that go with having a cleft lip and bilateral palate. As a parent with no experience in any of these kinds of things, it's very scary. It can be very intense. You don't really know where to go, who to talk to, kind of how to navigate all the different hoops that you kind of got to jump through. And that's one thing that NEIS really helped us out with, was kind of pointing us in the right direction and making sure that we got with, Roseman University, UNLV Health, and all of the associated doctors. Since then, since his birth in 2017, he's had 3 major surgeries correcting his cleft lip and bilateral palate with a spacer and braces as well from Roseman University. And he's actually having an upcoming schedule surgery in July for his bone graft. All the while bouncing around seeing Dr. Chen from Roseman University as well. And so I really think that having this centralized hub for parents and kids is crucial. Because there's a lot of moving parts here, and it can be very overwhelming. And the current team from UNLV Health and Roseman University have been exceptional. They've been amazing in instilling confidence into my son and myself through their expertise. I really think funding and consolidating would be the most effective method here. Thank you.
Thank you. Next caller, please.
Hello, my name is Charles Calder. I'm an oral maxillofacial surgeon in Nevada. I'm calling in support of one of my assistants, Stephanie, whose son is enduring the treatment of a cleft lip palate. Although I don't treat these patients anymore in my practice, through my formal training, we were part of a craniofacial team, and the importance of having the coordinated care among the different specialties is critical for the patient as well as the family. So I'm calling in support of the Nevada Senate and Assembly to provide funding for this Nevada craniofacial team or clinic. Thank you.
Thank you very much. Any additional callers, AVH?
Chair, there are no more callers in support at this time.
Thank you very much. Then we'll go to opposition. Anyone here in Carson City in opposition? Seeing none. Anyone in Las Vegas in opposition? Seeing none. AVH, we'll go to the phone lines. Anyone in opposition?
To testify in opposition on SB 280, please press star 9 or raise hand in the Zoom window to take your place in the queue. Chair, there are no callers in opposition at this time.
Thank you very much. We'll go to neutral. Anyone here in Carson City in neutral? Anyone in Las Vegas? Anyone on the phone lines? AVH, when you're ready.
To testify in neutral on SB 280, please press star 9 or raise your hand in the Zoom window to take your place in the queue. Chair, there are no callers in neutral.
Thank you very much. And with that, any closing comments? Senator Wynn. All right, with that, I will close the hearing on Senate Bill 280, and we will go to Senate Bill 316, which is also Senator Wynn. Please begin when you're ready.
Good morning, Rochelle Wynn appearing to present Senate Bill 316. We already had a policy hearing on this. So what Senate Bill 316 does is expands the scope of certain provisions related to pharmacy benefit managers, or PBMs. It prohibits certain practices and adjusts the compensation and fiscal practices of pharmacy benefit managers. Hopefully you all have copies of the amendment that we had been working on this that removed certain individuals, and that includes some of the fiscal impact that's before you. There was a pretty big fiscal impact on PEB, and we confirmed that the amendment removes that fiscal impact. The Attorney General has also indicated that there's no impact with the amendment there, and she also has confirmed that there's no fiscal impact. And also DHCFP, which honestly I don't know what that stands for, also has an unsolicited fiscal note and confirms the bill as amended has no fiscal impact. B&I does have a little bit of a fiscal impact because there would be some increased oversight responsibilities as a part of oversight on the PBMs. And so there would be an additional position staff that would be required to make sure that this bill was implemented correctly. Charter schools, I believe, have removed that, as well as the other school districts. There were some other places, including the city of Henderson. We did amend out Section 40, which they are now removed from the bill, so I'm not sure why they have an impact. And if they are here, I did see a representative from the city of Henderson, and they might be able to indicate why they have a fiscal impact. I honestly don't understand myself, but with that, we'd stand for any questions.
Thank you very much. And with that, any questions from the committee? Senator Cannizzaro.
Thank you, Madam Chair. So as I am listening and you're going through the list, it sounds like with the proposed amendments that you have for today, there's just the increased, there's an additional position for business and industry for the oversight purposes. There's still a section that pertains to cities and counties, but that section was actually removed from the bill, so there shouldn't be a fiscal impact to them. We would love for them, if they can, to confirm that. But otherwise, the other fiscal notes or fiscal impacts have been removed.
Kaylin Cardavani for the record. Just because I think the amendments are moving so fast and everything, I do think the city of Henderson actually will be in neutral. I will let them confirm that, but in section 21.5 and 22 now of the bill, which was originally when they were included in that section 40 that we removed, they, along with firefighters and all other local governments, were removed. And so just like Medicaid and PEB and any of those services, they should be exempted from this bill.
Okay, so what we're hoping is to get that confirmation, and then the only remaining fiscal impact is just a position within BNI. And you're nodding your heads yes, so I'm taking that as a yes.
Rochelle Wynn for the record, yes.
Okay, thank you very much. All right, any additional questions on this piece of legislation? All right, with that, step back. We'll go to in support. Here in Carson City, if you are in support of Senate Bill 316, please come forward.
Good morning, Madam Chair and members of this committee. Liz McMenamin, MACMENAMIN, with the Retail Association in Nevada, representing our community pharmacies in our state. And I am just going to say we strongly support this bill and appreciate you taking this up, and we look forward to seeing it moving forward. Thank you.
Good morning, Chair Dondera Loop, members of the committee, Jennifer Lanahan, Lanahan, here on behalf of the Nevada Pharmacy Alliance, and we will just do a quick us too. Thank you.
Thank you, Chair and members of the committee. For the record, my name is Paige Barnes with the Ferrato Company, here today on behalf of the Nevada Society for Dermatology and Dermatologic Surgery. Me too. Thank you.
Any additional support here in Carson City? Seeing none, we'll go to Las Vegas. Any support for Senate Bill 316 in Las Vegas? And on the phone lines, AVH, when you're ready.
To testify in support on SB 316, please press star 9 or raise hand in the Zoom window to take your place in the queue.
Good morning, Chair Dondera Loop and members of the Senate Finance Committee. My name is Jacqueline Nguyen, Nguyen, and I represent the Nevada State Medical Association. SB 316 offers comprehensive pharmacy benefit manager reform that is much needed in Nevada. Transparency of PBM practices is crucial for patient protections. And finally, we believe that patients should be the beneficiaries to any cost-saving programs related to their prescription medications. Therefore, we're in support of SB 316. Thank you.
Thank you very much. Next caller, please.
Chair, there are no more callers in support at this time.
Thank you very much. And with that, we'll go to opposition here in Carson City. Is there anyone in opposition? Please go ahead when you're ready.
For the record, Dwayne Young, good morning. Chair Dondera Loop and committee members, thank you for the chance to provide public comment today. My name is again Dwayne Young, and I am the State Director for Government Affairs for CVS Health here in Nevada. I am also the former Deputy Administrator of DHCFP, the Division of Healthcare Financing and Policy, where from 2017 to 2021, I oversaw the state PBM contract and pharmacy policy. I come today to speak in opposition of this bill, which will increase healthcare costs for Nevadans. As written, the bill seeks to eliminate pay-for-performance contracting between PBMs and pharmaceutical manufacturers. In doing so, this bill will take away the ability of PBMs to put downward pressure on the prices of drugs, drug prices that are solely set by the manufacturer. Economist Casey Mulligan estimated the cost of impacts of this policy, studied as published in the National Bureau of Economic Research. He estimated an increase in health insurance premiums from $4 billion to $12.8 billion in Medicare Part D and $8.4 billion to $26 billion in commercial health plans nationally. We estimate the impact of this policy to the fully insured Nevadans will cost our members $3 to $5 per month. Nevadans are not getting an additional service or benefits from spending this money. They will just have higher healthcare costs for the same services they are receiving today, while drug makers will rake in higher profits. The study also suggests that ending pay for performance could result in reduced utilization by reducing insurance premium coverage. As PBMs obtain less rebates and discounts for their clients, plans must increase premiums to finance their drug benefits. Consumers may respond by reducing coverage. This, along with other financial pressures in the healthcare segment, may result in larger numbers of uninsured individuals. In Nevada, this would be a direct impact of the Economic Forum's projections on the managed care tax. At this time of considerable economic uncertainty in Nevada, we believe it would be very detrimental to Nevadans to pass this policy, as it will impact their ability to access affordable health insurance. We respectfully ask you to vote no today on Senate Bill 316.
Thank you, Madam Chair. Members of the committee, Paul Young with Tom Clark Solutions on behalf of Farm School Care Management Association. The majority of the Farm PCMA's testimony is going to be on the phones. Ike Brennan, he's an economist, and Amanda Frotz, who's a PhD, head of the research PCMA. She's more 12 years in healthcare policy and finance. So thank you, Madam Chair.
Good morning, Chair Dondera Loop and committee. For the record, Shelley Capurro, representing the Nevada Association of Health Plans, which is an 11-member organization of public and private health plans. And we have previously opposed this bill in the policy committee, and we're here again today to oppose the bill on more of the fiscal impacts. As written, the bill aims to end performance-based compensation and other tools that PBMs use in negotiating with pharmaceutical manufacturers. The lack of these tools will drive the cost to which health plans pay, which will ultimately be passed on to members at an increase of $3 to $5 per member per month. This bill will not force manufacturers to negotiate contracts for the fully insured market, resulting in increased costs for Nevada businesses. This will also impact Nevadans with increased financial pressures and impact their ability to pay their premiums, putting at risk the Economic Forum projections for a steady managed care tax premium. Thank you for your time.
Thank you very much. Any additional opposition here in Carson City? Seeing none, we'll go to Las Vegas. Any opposition? Seeing none. ABH on the phone lines. Any opposition?
To testify in opposition on SB 316, please press star 9 or raise hand in the Zoom window to take your place in the queue.
Good afternoon, Chair and committee members. Thank you for letting me speak. My name is Kimberly Fergus, F-E-R-G-U-S. I strongly oppose SB 316. I want to echo what the others have said, and this is my testimony. SB 316 adds excessive red tape to pharmacy benefit managers, increasing administrative costs that will inevitably be passed down to consumers through higher premiums and drug costs. The mandate for detailed reporting of rebates and fees sounds good in theory, but it will escalate costs without guaranteeing any real savings to patients. Prohibiting PBMs from steering patients to affiliated pharmacies disrupts existing networks, raising costs and potentially limiting access to essential medications. Imposing a fiduciary duty on PBMs to insured persons creates unprecedented liability, discouraging PBMs from operating in Nevada and reducing competition. SB 316 overreaches in its regulatory scope, increasing costs without delivering actual savings to consumers. I urge you to vote no. Thank you.
Thank you very much. Next caller, please.
Good morning. Chair Dondera Loop and members of the committee, my name is Dr. Amanda Frost, F-R-O-S-T. I've been a health services researcher for the last 12 years, and I'm currently the head of research at PCMA, the National PBM Trade Association. I'm here respectfully in opposition to SB 316 because of the cost impact it will have on payers and patients. Our concern with the restriction in PBM contracting, the so-called delinking policy, is that the fiscal impact will have unintended and harmful consequences on health plans, employers, and patients in Nevada. If this policy is enacted, drug companies will see increased profits on the backs of employers and patients. My team did a fiscal analysis of the bill. and we estimate the bill could result in up to $200 million in increased premiums and additional increased expenditures in the form of higher drug costs and spillover healthcare spending. While we appreciate the interest in the prescription drug supply chain, this policy will cause drug costs and health insurance premiums to increase, costs that will be paid by employers and patients. Our fiscal analysis was based on an economic model developed by Professor of Economics at University of Chicago, Casey Mulligan. Dr. Mulligan's model finds that PBM negotiated drug rebates will decrease and drug company profits will increase if delinking is enacted. Based on this model, I believe there will be three important fiscal impacts of this proposed legislation. First, drug prices will go up. Only drug manufacturers set and raise drug prices, but they don't have unlimited pricing power. When available, the leverage of PBMs helps keep prices in check. One of those checks is the drug rebates that PBMs negotiate from drug companies, which create a downward pressure on pricing. A delinking policy would remove that downward pressure, likely leading to rising drug prices and higher new drug launch prices. And when drug prices go up, combined with drug rebates going down, the result is higher drug costs for everyone else. Second, drug costs will go up for payers. The combination of higher drug prices and lower rebates will mean higher costs for payers, especially employers. And because of the nature of the policy, it may hit small businesses the hardest. According to the U.S. Small Business Administration, there are over 50,000 small businesses in Nevada, employing over 500,000 Nevadans. This is the group that may have the hardest time bearing the increased drug costs which will lead to higher premiums. We know from many surveys of employers that nearly all of them choose to use the drug rebates passed to them from their PBM to buy down premiums or make their drug benefits richer through things like lowering out-of-pocket cost sharing. With fewer drug rebate dollars available to the employers for these actions, premiums will necessarily rise. And finally, third, Nevadans with employer-sponsored health insurance will feel these higher costs. I believe that employers, and especially small businesses, will not be able to absorb the financial impact of higher drug costs and higher premiums without passing those, in part, along to their employees. And higher premiums and higher cost sharing for employees, in addition to creating a new financial burden, may also lead to a reduction in employer-sponsored insurance coverage, which could reduce appropriate drug and healthcare service utilization. In summary, based on the economic model and my fiscal analysis, I believe this policy will lead to higher profits for drug companies paid through higher spending by employers and patients. We are not opposed to oversight, but we are opposed to public policy that results in higher costs for small businesses and ordinary Nevadans. And for these reasons, we respectfully ask the committees not to advance SB 316.
Thank you very much. Next caller, please.
Caller with the last three digits, 893, please press star 6 to unmute yourself.
Thank you, Chair Dondero Loop. My name is Ike Brannon, Brannon, and I'm an economist and senior fellow at the Jack Kemp Foundation, which is a research institute in Washington, D.C. And in that job as a senior research fellow, I published several studies on pharmacy benefit managers. And one thing that my research has shown is that delinking is not going to save money for healthcare plans in the state of Nevada or anywhere else. The current practice incentivizes PBMs to attain the largest cost savings when they negotiate drug discounts, since their payment depends on the size of the discount. A study I did with Tony Lasasso, professor at the University of Illinois, on PBMs being used in Midwestern states has found that when states do adopt PBMs, they find significant savings on the cost of new drugs. And the other thing we found is that aligning incentives is really important, and having the payments made to pharmacy benefit managers tied to the amount of their discount incentivizes them to get the biggest discounts available. Getting rid of going to delinking will not only increase healthcare costs, it's also ultimately going to increase how much Nevada has to spend on healthcare, since they will end up paying more for the prescription drugs it provides for residents on Medicaid. More broadly, the idea that more transparency is needed in the PBM market is a ruse. The opposition to delinking, the advocacy for delinking and opposition to PBMs in general has been driven solely by pharmaceutical companies who don't like the fact that PBMs exert downward pressure on drugs, and independent pharmacists who don't like that PBMs also put downward pressure on how much they get for this and also cut them out of the loop with things like the direct delivery of drugs. I think the delinking amendment would significantly impact the cost of drugs to people and healthcare plans in the state of Nevada. Thank you.
Next caller, please.
Hello, Chair and members of the committee. My name is Katrin Ivanov. For the record, Katrin, as in Nancy, IVANO, Frank. I'm in opposition of this bill for everything that the opposition already said. Healthcare is expensive as it is. We don't need to make it more expensive. And it looks that this bill, even though may be very well intended, is going to bring unintended consequences that would make it harder for Nevadans. We already have hard time surviving. You guys are trying to bring taxes up, and now healthcare is going to get more expensive. It's going to get to the point we won't be able to live in Nevada, which is really sad because I really love that state and I really don't want to move somewhere else. So please vote no on this bill. Thank you and have a lovely day.
Thank you very much. AVH, any more callers, please?
Chair, there are no more callers in opposition at this time.
Thank you very much. And we'll go to neutral here in Carson City. Please come forward and begin when you're ready.
Thank you, Madam Chair, members of the committee. Adam Plain, Plain, with the Nevada Division of Insurance. We are the agency that does have the fiscal note on the bill currently. I did want to clarify that it's actually 3 positions and a contractor position funded under the fiscal note. Section 1 of the bill relates to reporting requirements that would require the contractor position to accumulate and disseminate that data. The other 3 staff positions, 2 of them are for examiners that would be required under the increased regulation and oversight under the bill, and 1 is for a consumer services person to handle the influx of calls that we anticipate would be generated as a result of implementation. Our fiscal note puts it at about $960,000 per biennium for those staff positions and support. Would note that the Division of Insurance is an enterprise-funded agency, does not receive general fund revenues, and pursuant to NRS 680C.110 sub 7, the legislature has granted the division the authority to set its own administrative and enforcement fee to fund the agency pursuant to a public hearing held by the commissioner each biennium. If there's any questions related to the fiscal note or the agency's funding, I'd be happy to answer.
Mr. Plain, really quick, have you seen the mock-up of the amendment?
I've saw it very, very briefly as we were hearing the presentation.
Okay, so your $960,000 is current, not with the mock-up.
Adam Plain, for the record, that's correct. It was the $960,000 was as presented. Pursuant to the first amendment that was adopted in the policy committee, our fiscal note did not change, and I have not had a chance to digest the amendment to determine if there's a fiscal impact change yet. Although, to be frank, I would have to say I would doubt that the fiscal impact would change or go down, really because of the oversight and the reporting proposed in the bill. There's not really a way to eliminate the fiscal impact to the agency.
Thank you very much for that information. All right, go ahead, please.
Thank you, Chair, members of the committee. For the record, Mike Cathcart representing the city of Henderson. I first want to thank Senator Wynn for providing the conceptual amendment, and the changes to sections 21.5 would eliminate our $150,000 fiscal note, taking that to zero. Thank you.
Hello, Madam Chair, members of the committee. My name is Ashley Kennedy, representing Clark County. I just wanted to echo the comments of the City of Henderson, and I appreciate the bill sponsor in considering the self-funded health plans. And we did, on the fiscal note that we did file, we indicated that we could not determine. We knew it would have an impact, but we weren't sure how big or how small. And so we appreciate this. It would not have a fiscal impact to Clark County. Thank you.
Good morning, Chair Dondero Loop, members of the committee. For the record, my name is Cadence Matijevich, Cadence representing Washoe County. We too had a fiscal note on the original version of the bill as it cannot be determined. We're appreciative of the amendments that have been brought forward that would remove our self-funded plan from the provisions of the bill, and with that, our fiscal note is eliminated. Thank you.
Thank you very much. Any additional neutral here in Carson City? Seeing none, I'll go to Las Vegas. Seeing no one at the table, I'll go to the phone lines. AVH, when you're ready, neutral.
To testify in neutral on SB 316, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in neutral at this time.
Thank you very much. All right. Any additional comments? All right. Thank you very much. All right. With that, I'll close the hearing on Senate Bill 316. And I will open the hearing on Senate Bill 323. Sorry. Yes, Senate Bill 104. No, I was going in order. I just lost my agenda. Please go ahead when you're ready.
Thank you so much. Good morning, Chair Dondero Loop, Vice Chair Wynn, and the members of the Senate Committee on Finance. For the record, my name is Julie Pizzina, representing Senate District 12 in Clark County, and I'm so pleased to be here today to present Senate Bill 104, which makes an appropriation for the creation and maintenance of school gardens. With me today is former Senator Mo Dennis, as well as Woody Worthington, the director of our Green Our Planet National Partnerships. The impetus of SB 104 stems from a growing body of research and community advocacy highlighting the positive impacts of school gardens on student learning, health, and community involvement. School gardens have been shown to improve academic outcomes, particularly in science and mathematics, by providing real-world context for learning. Furthermore, such programs can promote healthy eating habits, environmental stewardship, and vocational skills. And by leveraging the expertise of nonprofit organizations with proven expertise, the bill seeks to ensure school garden programs are both effective and sustainable. The proposed amendment, which should be in your hands, would reduce the amount of the appropriation to $200,000 for each fiscal year from what was additionally asked for. One reason we believe this program is so important is because it touches 400 different schools in the state, and I believe former Senator Dennis is going to tell you exactly how many students are impacted by this program, but this is a fiscal committee, and so I did want to share the updated appropriation and also let you know that the Student Farmers Market will be this Thursday from 10 a.m. to 1 p.m. right outside the building. And with that, I'm going to hand it over to former Senator Dennis.
Thank you very much, and welcome, Senator Dennis, back to the body. Please go ahead.
Thank you very much, Chair. Mo Dennis, for the record, representing Green Our Planet. I wanted to share with you some statistics. First, 250,000 students are directly impacted by this program. As was mentioned, it's in 416 Nevada schools, which makes Nevada the largest school garden program in the country. There's 250 schools that have been added since 2023. 4,600 hydroponic systems have been distributed across Nevada. Green Our Planet operates in 16 of the 17 Nevada counties. Mineral County would have one, they just don't have the resources currently to be able to do that. Over 1,300 students participate in the giant student farmers markets in Carson City and in Las Vegas. We did an impact study. 93% of students that participate have improved in STEM academic achievement after 1 year. 88% of students became more engaged in STEM learning. 79% of the students increased their consumption of fresh vegetables and fruit. And 66% of teachers noted improved student culture. And there's 1,400 teachers that are impacted by this program. It boosts, as was mentioned before, it boosts STEM learning. So it's not just about growing gardens, as you see one here, but it's also about STEM, learning how it works. And they learn not only through outdoor gardening, but indoor hydroponics. It teaches nutrition, conservation, sustainability. It builds financial literacy as well as entrepreneurship skills. When they do their farmers market, make sure you have plenty of money, because these kids are really good at selling their goods, and they learn about financial management as part of this. It increases student engagement with project-based learning. And one thing that real important is it provides standards-aligned lessons across multiple subjects to teachers. So these are available to all teachers in the state of Nevada, regardless of whether they have school garden or not. They have access to the materials that have been developed, video as well as the lessons. And with that, make sure I covered everything. There is a video that we did put together. We just don't have time today. It's only 2.5 minutes, but we'll make that link available to you if you'd like to see what the kids are doing. Some incredible stuff that they're doing with AI, chatbots, and to be able to learn and teach some of this stuff, as well as all the other things that they're doing. So with that, I think that's all I have.
Thank you, and we are open for questions.
Thank you very much. Any questions from the committee? Dr. Titus, Senator Titus.
Thank you, Madam Chair. So thank you for being here. And I think critical thing is it's just not an urban issue. I've toured some of your programs in my rural areas and pretty supportive, especially the programs, the hydroponics in the driest state in the nation, that we would have more school gardens. My question actually is a fiscal one, however, as much as I like the policy. You have a pretty good corporate model that helps to support your program. And I see that, the request has dropped dramatically from what you had originally presented to us. And so the sustainability of these programs is really, I think, Senator Dennis in the past, could you just go over a little bit about what that corporate model is? Because I think it's a very impressive one, and it really actually, I think is a good thing.
Thank you, Madam Chair. Thank you, Mo Dennis, for the record. So on the model the goal is to become self-sustaining over a period of time. Over the last 3 years, we've received $10 million in philanthropy dollars, as well as the nonprofit organization also now has 2 for-profit Green Our Planet Studios, which produces films and other things to be able to teach, and then the side of the company that also creates the hydroponics and all of the materials that are available. So the profits from those are put back into the program. So we're trying to become self-sustaining by creating these for-profits to be able to provide that. In addition, we did receive $2.7 million with the ARPA funds that helped us to increase the number of schools that are in this program. So I don't know if that completely answers the question.
I just wanted to point out, and thank you for that, because I wanted to point out that what you're doing and the corporations are doing, or what you're doing in the program, they, not you necessarily, is that they're going to companies, I think you explained to me, and putting these in some of these corporations in their offices, and then they're getting paid for that, and that can then be parlayed up to being used in nonprofits in the school garden. So I think it's a real unique model that you're using for-profit companies that then give back to the nonprofit aspect of that.
Madam Chair, thank you. Woody Worthington for the record. Yes, absolutely. So it's called our Work Well program, and it's been successful. And 100% of the profits will go back to the schools. So it's kind of a BOGO, right? Everybody's got to go back to work, right? This new right to work, what do we do? I guess they don't want to do goat yoga anymore, but we're providing hydroponics now. So that in and of itself gives the opportunity for the employees to enjoy the program too as much as the kids. So so that funding that the corporations put back into the schools and support them as well. So hopefully that answered your question. Thank you.
Thank you very much. Senator Neal, did you have a question?
Thank you, Madam Chair. I was just wondering, have you guys been able to, in the program, when you guys, not you specifically, but Senator Dennis, when we did the Green Our Planet visit to Priest Elementary, we talked about how parents or abuelas can offer insight into how they garden and then teach and then maybe be mentors also within the cycle within the schools, because they actually have grown their own gardens and they can pass that information down, and maybe trying to integrate them into the program.
Thank you, Woody Worthington, for the record, Green Our Planet. Yeah, absolutely. We're seeing such an impact with that. It's kind of a holistic approach. We have a lot of the volunteers, right? When gardens come in there, it's like they dry up, but where it's the community engagement that we're really seeing the impact with that. So we have several schools that are supporting that with different programs with nonprofits that are coming in. It's definitely a team event that we support. But yeah, the community engagement is really encapsulating and very important that we see through all 16 of the 17 counties. Like I went to all 17 of them last year, and it's a big state, no doubt about it. But we see the uniqueness in each county that everybody can support and do their kind of own thing, if you will, whether it's Eureka, Humboldt, or Pershing. So, but yeah, we're getting the community involved for sure. Thank you.
Thank you very much. Any additional questions? Seeing none, thank you very much. If you'll step back, I'll call forward those in support along with the green plant. Those in support here in Carson City, Las Vegas. Seeing none, AVH. Oh, please go ahead.
Good morning, everyone. Hope you're doing well. Thank you, members of the committee. Cyrus Hojjati, Hojjaty, and I support this bill. It's great to see the former state senator.
Thank you very much. Anyone else in support here in Carson City? In Las Vegas? On the phone lines, AVH, when you're ready.
To testify in support on SB 104, please press star 9 on your phone to take your place in the queue.
Hello there, Chair Dondero Loop and the committee. My name is Kira Burns, and I am the CEO of Green Our Planet. STEM jobs are growing at twice the rate of non-STEM jobs today in the United States. And while the average non-STEM salary is only $46,000, STEM jobs average over $95,000 a year and often a lot more. Listen, that's not just a paycheck. That's a path to economic mobility for Nevada families. By supporting school gardens through SB 104, we're giving students hands-on STEM experiences that spark curiosity, build real-world skills, and prepare them for the careers of the future. And in reference to what Woody Worthington referred to earlier, is we've carried out the first AI interactive chatbot pilot in a school in the United States at Jen Jones Blackhurst recently to great success. So this bill will strengthen our economy, uplift our communities, and ensure every Nevada student has a chance to grow, literally and figuratively. Thank you very much.
Thank you very much. Anyone on the phone lines, AVH?
Good morning, Chair and members of the committee. For the record, my name is Christy Cabrera-Georgeson. I'm the Deputy Director of the Nevada Conservation League, and we're here in strong support of SB 104. School gardens allow students to get in touch with nature while learning where food comes from and gaining a hands-on understanding of the natural sciences. Additionally, studies consistently show that getting kids outside contribute to numerous health and mental health benefits. We urge the committee's support. Thank you.
Thank you very much. Phone AVH, anyone else on the phone lines?
Caller with the last three digits, 760. You are unmuted and you may begin.
Good morning. This is Cynthia Perrine, CYNTHIA PERINE. This is a wonderful bill. I support it. Thank you.
Thank you very much. AVH, any other callers on the line?
Yes, Chair.
Hi, Chair and members of the committee. Thank you for presenting such a good bill and giving it a chance. My name is Katrina Ivanov. I apologize. IVANO Frank. Please vote yes on that bill. I long time wanted to have something like that done for possibly all the schools, but at least to start with this, it's a good start. And can you please, this is the first time I'm hearing about that, can you please give more information or where is the Las Vegas student farmers market? I would love to go and support those kids. And please vote yes. Thank you. Have a lovely day.
Thank you very much. Next caller, please.
Good morning. This is Tammy Romo, TAMIROMO. I do support SB 104. School gardens is a great concept and a way to help support yourself in the future. Thank you.
Thank you very much. Next caller, please.
Chair, there are no more callers in support.
Thank you. Thank you very much. We'll go to opposition here in Carson City. Seeing none. We'll go to Las Vegas. Seeing none. AVH phone lines for opposition.
To testify in opposition on SB 104, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in opposition at this time.
Thank you very much. We'll go to neutral here in Carson City.
Good morning, Amelia Thibault for the record, THIBAULT. I'm here on behalf of the Nevada Department of Education. We do have a fiscal note on this bill, but having seen the amendment reducing us to only $200,000, I do believe we'll be able to significantly reduce the fiscal note on this bill, likely to a small portion of overtime for an education program professional to develop the notice of funding opportunity and do competitive review. Otherwise, with only $200,000, likely to a much more limited number of subrecipients, we do believe we'll be able to remove the positions placed otherwise.
Thank you very much. All right, any additional neutral here in Carson City? Any neutral in Las Vegas? Seeing none, is there anyone in neutral on the phone lines, AVH, when you're ready?
To testify in neutral, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in neutral at this time.
Thank you very much. Any closing comments, Senator Pizzina?
Thank you so much again, Julie Pizzina, for the record. And just a reminder to please go to the farmers market in front of the building from 10 a.m. to 1 p.m. on Thursday to see some of the amazing kids that are taking part in this program. Thank you.
Thank you very much, and thank you for the presentation. All right, with that, I'll close the hearing on Senate Bill 104, and we'll open the hearing on Senate Bill 240. And Senator Pizzina, when you're ready.
Good morning, Chair Dondero Loop, Vice Chair Wynn, and committee members of the Senate Committee on Finance. It's me again, Julie Pizzina, representing Senate District 12 in Clark County. Thank you so much for allowing me the opportunity today to present Senate Bill 240, which revises provisions relating to state business licenses. The intent of this bill is to help small businesses succeed in Nevada. One of the top barriers to small business success is the cost of obtaining the required licenses and permits. High license fees can significantly impact the initial capital and ongoing operational costs of startups and small business. To reduce the burden of new and existing small businesses, the bill reduces the fee for the issuance of a state business license to entities with fewer than 50 full-time or part-time employees and only for the very first year. It moves the fee from $200 to $100 to help those small businesses and entrepreneurs start up. This is, however, a fiscal committee, and we wanted to make you aware of our amendment, which you should have. This act becomes effective on July 1, 2027. And I would also like to point out that I apologize, on the first reprint, it still says 2025, but we did provide the amendment for 2027, so please note that this act would become effective on July 1, 2027. And we are both here to answer questions. We don't want to take too much of your time this morning.
Thank you very much. I appreciate that. Any questions from the committee? All right, seeing none, you may step back and we'll go to support here in Carson City. Please come forward when you're ready and begin.
Good morning, Chair Dondero Loop, members of the committee. My name is Tomas Hammond, Tomas Hammond, with Carrera, Nevada, here on behalf of the Henderson Chamber of Commerce and our over 2,000 members, the majority of whom are small businesses in Southern Nevada. Nevada prides itself on being a business-friendly state, and SB 240 reinforces that commitment. By reducing the initial financial hurdles, we are empowering small and micro-sized business owners to pursue their dreams and contribute to our thriving economy. We believe this bill will encourage entrepreneurship and foster sustainable growth in Southern Nevada, and we urge the committee to support SB 240. Thank you.
Thank you very much. Please go ahead.
Good morning, Madam Chair, members of the committee. My name is Janine Hansen. I'm the state president of Nevada Families for Freedom, and we support this bill. It's important to encourage and promote small businesses, which are the backbone of the economy and which help so many families, and I think this will be a very positive measure. We wish it was more extensive, but we're happy for what it is, and we encourage you to support it. Thank you.
Thank you very much. Any additional support here in Carson City? Seeing none, we'll go to Las Vegas. Please go ahead.
Thank you very much, Chair Dondero Loop and members of the Senate Committee. My name is Anahit Baghshetsan. For the record, that is ANAHITBAGHSHETSYN, and I'm a research assistant at Nevada Policy. Today, we come in strong support of Senate Bill 240. As was mentioned before, the small businesses are the backbone of the Silver State economy, but I would like to provide some research and statistics to make our point. Small businesses account for over 99% of all the businesses and employ over 42% of all the labor force in Nevada. However, despite their big role and big share, they still face a lot of hurdles. According to 2024 Small Business Challenges survey conducted by Nevada Small Business Development Center, 23% of all startup founders in the Silver State find it hard to navigate business licensing requirements. The number grew to 38% for healthcare startups and 45% for all the rural businesses. So evidently, communities that are disadvantaged are a little bit more at risk, and bills like this can make sure that everybody has the opportunity to pursue their dreams, to be productive business in the state, and ensure that Nevadan businesses keep booming. So for those reasons, we urge your support. Thank you so much.
Thank you very
Madam
much.
Chair, members of
Go ahead, please.
Madam
Madam Chair, members of the committee, my name is Gabriel DeCara, Chief Deputy Secretary of State, and I'm here testifying in support of SB 240 on behalf of Secretary of State Francisco Aguilar. Secretary Aguilar believes the way to grow Nevada's economy is by supporting small businesses, and SB 240 is a common sense bipartisan initiative to do just that. Our office has attached an updated fiscal note based on the recent amendments, including the effective date of July 1st, 2027, and this fiscal note should be looked at as the absolute maximum potential cost to the state. By investing in business now, we can help build a brighter future for Nevada. Thank you very much.
Thank you very much. Seeing no more additional support in Las Vegas, we'll go to the phone lines. AVH, when you're ready.
To testify in support on SB 240, please press star 9 on your phone to take your place in the queue.
Hi, Chair and members of the committee, Catherine Ivanov, IVANO Frank. I am in support of this bill. Anything that can help small businesses, we owe it to them, especially after the last few years. I ditto the previous caller, and please vote yes on this bill.
Thank you very much.
Good morning. Good morning. This is Lynn Chapman, LYNNCHAPMAN, and I'm the State Treasurer of the Independent American Party. The Independent American Party platform supports business, especially small businesses. I got my hair cut and I told my hair guy about this bill. He supports his family and is working hard, but he said that the business license is expensive at $200, and he was thrilled to hear it might go down to $100, and that would help him to keep in business. I checked on the internet and saw Kentucky has the cheapest filing fee at $40 with an annual fee of $15. Arkansas came in second with 3 million people, close to 260,000 small businesses employing 500,000 people. The filing fee was $45 with an annual fee of $150. Arizona is number 3, and it leads the country in job growth. The filing fee there is $50 with an annual fee of $0. I found some quotes to show the importance of small businesses. Anonymous said, quote, "When you support a small business, you support a dream," unquote. Richard Branson said, quote, "A big business starts small," unquote. So please help our small businesses and encourage them to stay in business. Please vote yes on SB 240. Thank you.
Thank you very much. Next caller, please.
Good morning, Chair, members of the committee, Samantha Barnes, BARNES, on behalf of the Las Vegas Global Economic Alliance. LVGEA is here today in full support of SB 240. Thank you.
Additional callers, AVH?
Hello, this is Cynthia Perrine. This is a wonderful common sense bill. I support it. Thank you.
Next caller, please.
Wiz Rizard, WIZROUZARD, and on behalf of Americans for Prosperity Nevada, we absolutely support this bill. As everyone stated, this is very important in driving our economy, especially for small business owners. And we believe that whenever things like fees or taxes are low, compliance is a lot more
Next caller, please.
If you've recently joined the call and would like to testify in support on Senate Bill 240, please press star 9 on your phone to take your place in the queue. Caller with the last 3 digits, 939, please press star 6 to unmute yourself.
Good morning. This is Tammy Romo, Tamiro. It's imperative that we support the small businesses. So I think it's great that we are lowering the price so that we can attract more small businesses and keep them in business, especially after, we're still recovering and they got hit the hardest during the pandemic. So we want to support them and make sure that they can get on their way. I just wish it would start in at least 26, not 2 years down the road. But I do support it. Thank you.
There are no more callers in support at this time.
Thank you very much. Those in opposition? In Carson City. Those in opposition in Las Vegas. Those in opposition on the phone line, please.
Chair, there are no callers in opposition at this time.
Just confirming, AVH, no callers in opposition?
Chair, there are no callers in opposition at this time.
Thank you very much. Here, neutral, here in Carson City?
My apologies, just 10 seconds. CYRUSHOJJATY. I just wanted to do support, and I'm done. I'll ditto what she said. Sorry about that. I was.
Thank you very much. Thank you very much. All right. Anyone else in neutral here in Carson City? In Las Vegas? And on the phone lines, AVH?
Chair, there are no callers in neutral at this time.
Thank you very much. Any closing comments? Okay, Senator Pazina, we are finished up with SB 240. And with that, we will go to Senate Bill 175, and we will call Senator Rogich to the table. Thank you, Senator Rogich, for your patience today. Welcome to Finance, and please go ahead when you are ready.
Good morning, Madam Chair, members of the Finance Committee. My name is Lori Rogish, representing Senate District 11, which is in the southwest area of Las Vegas. With me today is Lieutenant Colonel Caldwell. He is the director of the JROTC program with the Washoe County School District. Just a brief overview of the bill. Senate Bill 175 seeks to streamline the process for military personnel and veterans certified by the Armed Forces as JROTC instructors and reduce hiring barriers in our education system for such individuals. The inspiration for this legislation stems from the experiences of constituents like Bobby Padilla, a retired senior master sergeant from the U.S. Air Force who honorably served our country for 25 years. This bill not only honors the service of military personnel, but also provides a practical solution and paves the way for veterans to inspire the next generation. There was a fiscal note of $25,000 attached to the original draft of the bill. During the Senate Education Committee hearing, certain language was discussed and the stakeholders agreed to amend the bill. Unfortunately, the language was not revised in accordance with that discussion, and so the proposed amendment before you today reflects the agreement among the stakeholders. We have also been advised that this amendment eliminates the fiscal note. So thank you again on behalf of the hundreds of veterans who have reached out to me, and we appreciate your time and consideration regarding this bill. And we're available for any questions.
Thank you very much. Questions from the committee? Seeing none? All right. Thank you for joining us today, sir. And thank you for your service. All right, with that, we will ask for those in support of Senate Bill 175 here in Carson City. Welcome to the table.
Chair and committee members, for the record, my name is Andrew Lee Pilbett. I'm the state chairman of the United Veterans Legislative Council, representing the 250,000 veterans in the state of Nevada, and when you count their families, the 500,000 Nevadans. So we're in support of this bill as amended, proposed amended, as eliminating the fiscal note. This is a foundational group. We have in just for the counties, we have 38 different JROTC programs in the state of Nevada. So it's a very strong program in our state to help develop the leadership and the organization, commitment, and personal responsibility skills in our youth. And we highly support this bill. Thank you.
Thank you very much, and thank you for your service. Additional support here in Carson City will go to Las Vegas. Please go ahead when you're ready.
Chair Dundaro and members of the Senate Finance Committee. I am Fred Wager, Fredwagar, and I represent the nearly 15,000 members of the Departments of the Veterans of Foreign Wars and the Disabled American Veterans of Nevada. When you include their families, that's about 50,000 Nevadans. Thank you for allowing me time to testify in favor of SB 175. I've submitted my full statement in order to keep this short. I just want to say that VFW and DAV urge the members of Nevada Committee on Finance to support SB 175 with the proposed amendment. Thank you for your time.
Thank you very much, and thank you for your service. Any additional support there in Las Vegas? Seeing none. Phone line, AVH, when you're ready, callers in support.
To testify in support on SB 175, please press star 9 on your phone to take your place in the queue.
Hi, Chair and members of the committee. My name is Katrin Ivanov, I-V-A-N-O Frank, and I'm in very strong support of this bill. I have a very soft spot for veterans, kids, and elderly, and veterans have earned every single thing we can give them, and especially in this case, they have the knowledge, and we are short on not only teachers, but especially teachers with a specific knowledge, because what they learn cannot be learned in school. What they can share with our kids and inspire them is more than somebody that just graduated and go and teaches our kids. It is very specific niche, and I would really like to see you guys support this bill and pass it through so more veterans can help our youth love America again. And thank you for the people that are veterans there. Thank you for your service. Have a lovely day.
Thank you very much. Any additional support callers, AVH?
Good morning. This is Tammy Romo, T-A-M-I-R-O-M-O. I'm going to go ahead and ditto what Katrine said, and thank you for your service, veterans. And I think it's a great way to keep our veterans in society and doing what they do best, is protecting our country and teaching junior ROTC pupils what they have to look forward to staying in the military. Thank you.
Thank you very much. Any additional callers on the phone line, AVH?
Chair, there are no more callers in support.
Thank you very much. We'll go here at Carson City. Opposition to Senate Bill 175? Not seeing any. Las Vegas? Not seeing any. To the phone lines. AVH, when you're ready.
To testify in opposition, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in opposition at this time.
Thank you very much. We'll go to neutral here in Carson City.
Good morning, Amelia Tipo for the record, THIBAULT. I'm here on behalf of the Nevada Department of Education, confirming that the amendment as written does remove the fiscal note that we previously placed on the bill. Thank you.
Thank you very much. Anyone else in neutral here in Carson City? In Las Vegas? On the phone lines, AVH, when you're ready.
To testify in neutral, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in neutral at this time.
Thank you very much. And we'll go to Senator Rogich. No closing remarks, so we will close the hearing on Senate Bill 175. Thank you again for being here with us today. And we will go to Senate Bill 323. And Senator Scheibel, you are up. Thank you very much. And please go ahead when you're ready.
Good morning, Finance Committee. Thank you, Chair Dondero Loop and Committee for hearing SB 323 this morning. SB 323 extends a pilot program that we introduced in the 2023 session to allow people who are incarcerated at the Florence McClure Correctional Center to have 15 minutes of free phone calls every day with members of their family. The Florence McClure Correctional Center is better known as the women's prison. It does house women, many of whom, I think we had some statistics telling us close to 80% of whom are mothers. And over the last 2 years, thousands of phone calls have been utilized by people incarcerated at Florence McClure to talk to their children, their children's children, their siblings, aunts and uncles and parents. And the program, as we heard in the Judiciary Committee, has been wildly successful, which is why we're here in front of you today asking to continue the program. The pilot has since expired, and so in order to continue this program, we will need to update this chapter of the Nevada Revised Statutes, and the Department of Corrections will be responsible for ensuring that their contract with the phone company allows for those phone calls to continue to be covered. Happy to answer questions.
Thank you very much. Questions from the committee? I think they're silence. Okay, thank you very much. And with that, we will go to those in support here in Carson City for Senate Bill 323.
Thank you, Chair and committee members. My name is Nick Shepak, Nickshepak. I am the Nevada State Director of the Fines and Fees Justice Center. I'll be brief, but over 50 years of research shows that connection to families has a significant impact in reducing recidivism, increasing health outcomes, reducing children's involvement with the criminal justice system, increases successful re-entry, and decreases reliance on state assistance. So while it is very difficult to put a price tag on the money that we will save from a piece of legislation like this, the research is clear that the benefits are huge to the state, and for that reason we support the bill. Thank you very much.
Thank you very much. Any additional support here in Carson City? In Las Vegas? Seeing none. On the phone lines, AVH, when you're ready.
To testify in support on SB 323, please press star 9 on your phone to take your place in the queue.
Good morning, this is Tammy Romo, Tamiromo. I support this bill. I think it's important that the offenders keep touch with their families and the outside world to give them hope of a future. Thank you.
Thank you very much. Next caller, please, AVH.
Good morning. My name is Nicole Williams. I'm on the board of directors with Return Strong and also have a loved one who is incarcerated. Phone calls are a vital tool for communication and support. The cost of phone calls can add up quickly, and unfortunately, not everyone has extra funds to afford these very important calls. Having family support and connections while incarcerated helps reduce recidivism. Phone calls are something that both incarcerated individuals and their families look forward to. Please pass SB 323 and alleviate some of the costs and stress on incarcerated families. Thank you.
Thank you very much. Next caller, please.
Good morning, Chair Dondero Loop, Vice Chair Wynn, and members of the Senate Finance Committee. My name is Denise Bolaños Heredia, Bolanos Heredia. I'm the Associate Director of Return Strong, an organization that advocates for the rights and dignity of incarcerated people and their families, and we strongly support SB 323. We recognize your role as stewards of public funds. The fiscal note attached to this bill over 2 years is really a small investment for the life-changing impact of free daily calls at Florence McClure. You really can't put a price on a mother staying connected to her children, her parents, the support system, the people that step in to care for their child while they are incarcerated. 15 minutes a day can change a life. This bill is about human connection and rehabilitation and keeping families whole. We have the chance as a state to lead with both fiscal responsibility and moral clarity through this bill. We urge you to support it, and we thank Max and Senator Scheibel for championing this cause. Thank you.
Thank you very much. Next caller, please.
Chair, there are no more callers in support at this time.
Thank you very much. We'll go to opposition here in Carson City. Anyone in opposition? In Las Vegas, in opposition? On the phone lines. ABH, when you're ready.
To testify in opposition, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in opposition.
Thank you very much. We'll go to neutral here in Carson City.
Hey, good morning, Chair and members of the committee. My name is James Zarenda, DZURENDA. I'm testifying today in neutral just to give the impact that the study made with the community and with the residents that are at the Florence McClure Correctional Institution. There would play twofold of an impact on the pilot program that we had. It was a 6-month pilot program that allowed exactly what it says in this bill. And one thing it did make is what they already mentioned was the commitment and contact and that reestablishment of with the family members that were not done verbally. We do have the family members that wrote letters to us saying that this was the first time that they've ever spoke to their children. That was actually in verbal. They only communicated through the mail. A lot of these family members, it seems to me almost the majority of them, don't have the funds to be able to talk to their family or travel to their family, and this help with reconnecting them, especially if they're going home soon, which will help with keeping them showing the importance they are with their family and connection. The second impact that it made was actually for the reduction in violence of the facility. Having something that made an impact to the offender that meant something means even more when they lose it. They did lose use of phones when they resulted in disciplinary action. And when you have something that means this much to those offenders, they take it more serious, and you start seeing reductions in violence and reduction in incidents because of this, so they don't lose their phone calls. That's all I got.
Thank you very much. Any additional neutral here in Carson City? Las Vegas, on the phone lines. ABH, when you're ready.
To testify in neutral, thank you, Chair. To testify in neutral, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in neutral at this time.
Thank you very much. And with that, closing comments, okay, we will close the hearing on Senate Bill 323, and we will open the hearing on SB 389, and we'll welcome back Senator Scheibel.
Hello again. Still Melanie Scheibel for the record, representing Senate District 9 in Southwest Las Vegas. Thank you so much for hearing SB 389 this morning. I do have Ms. Jensen and Dr. Duncan here, I think. Yes, they are here in the back to answer more technical questions if you stump me, which very well may happen. But until that time, I'll just give you a very brief overview of what SB 389 does. This is a PBM bill for Medicaid, and it requires that Nevada State Medicaid utilize a single pharmacy benefit manager so that even though we continue to have between 4 and 5 managed care organizations, every single person who utilizes Medicaid benefits will have the same pharmacy benefit manager. This will streamline the process for Medicaid reimbursements for the Medicaid office as well as for pharmacists, because now everybody who has Medicaid will have one PBM that they have to go through instead of having different PBMs for different folks on the same or on equivalent health plans. And I understand it will cost some money to set this up. In the long term, I know that the Office of Health Financing Policy believes that this will save us money by having a single PBM. And I did submit an amendment, which is on Nellis, after discussions with Director Weeks or Administrator Weeks, a possible way to address some of the fiscal concerns would be to utilize the rebates we currently get from pharmacies and from pharmaceutical companies to fund the upstart and administrative costs for that single PBM. And I'm happy to answer any questions.
Thank you very much. And with that, I believe Senator Wynn has a question.
I have a question. I just, to clarify, I think I know the answer, but will the prescription drugs be carved out of the managed care and Medicaid will contract with the PBM for all Medicaid participants, or with the managed care organization contracts with the PBMs? I think the answer is no, that you're not carving them out, but I just wanted to clarify that with you.
Melanie Scheibel for the record. Thank you. You are correct, Senator. When we're not carving them out, the MCOs would still be responsible for contracting with the PBMs, or with the PBM.
Yes.
Singular.
Yes, singular.
That's kind of the whole point of the bill.
And using those rebates, I think that's probably a really responsible way. Obviously, it doesn't take away from general fund, but using those rebates as a funding mechanism, is that the intention of the amendment?
Melanie Scheibel for the record. Yes, that is the intention of the amendment, and I think it makes pretty good sense in this case. I mean, they are directly correlated. We receive that money through pharmaceutical rebates, and we're talking about trying to reduce prescription costs for the state and for people on Medicaid plans, and so that seems like an appropriate use of those funds.
Thank you. I think that for what it's worth, I think this will end up saving us some money and will provide better benefits for people in Nevada. So thank you.
Thank you very much. Senator Neal, did you have a question? Any additional questions? All right, seeing none, then we will go to those in support of Senate Bill 389. Please go ahead when you're ready.
Good morning, Chair Don Darrell Loop, members of the committee, Jennifer Lanahan, again, Lanahan, here on behalf of the Nevada Pharmacy Alliance. We just want to urge your support on this bill. We think it's long overdue, and we would really appreciate your support on SB 389. Thank you.
Thank you, Madam Chair and members of the committee. For the record, my name is Paige Barnes with the Fratto Company, here today on behalf of the Nevada Society for Dermatology and Dermatologic Surgery. Me too. Thank you.
Good morning, Madam Chair, members of the committee. Again, thank you, Liz McMiniman, Retail Association in Nevada. I appreciate the sponsor of this bill, and I appreciate what this body is doing to bring savings not only to the state, but to the patients and the others in this state that will benefit from this. So I appreciate it and look forward to as this bill moves forward. Thank you so much.
Thank you very much. Seeing no additional support here in Carson City, we'll go to Las Vegas. Seeing none there, we'll go to the phone lines. AVH, when you're ready.
To testify in support on Senate Bill 389, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in support at this time.
Thank you very much. We'll go to opposition. Here in Carson City, opposition. Opposition in Las Vegas. On the phone lines, AVH, when you're ready.
To testify in opposition, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in opposition at this time.
Thank you very much. And those in neutral, here in Carson City, in Las Vegas, and on the phone lines. AVH, when you're ready.
To testify in neutral on SB 389, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in neutral at this time.
Thank you very much. And with that, any closing remarks? Okay, Senator Scheibel, thank you very much. And with that, I will close the hearing on Senate Bill 389. All right, we will go to Senate Bill 373, and Senator Steinbeck has been waiting patiently. Thank you very much, and please, when you are ready, go ahead.
Thank you, Madam Chair. I appreciate the opportunity to be here. I'm very excited. My name is John Steinbeck, for the record, and I represent Senate District 18. I will be brief and stick to the physical policy for the most part of this presentation. I appreciate the opportunity to present Senate Bill 373 today, which requires the adoption of model ordinances for regional business licenses across counties and incorporated cities in Nevada. The bill aims to streamline the licensing process, reduce administrative burdens for businesses, and foster regional cooperation among local governments. We have been instructed to concentrate on the fiscal notes of this bill. So following our earlier amendment, which restricted this bill to counties over 700,000, the fiscal notes have been removed from Lyon County and Elko County, which were the only two that indicated an increased expense. I did discuss this with Wayne Thorley, and he said that we had satisfied the removal of those fiscal notes. He did send an email to the Secretary of State asking if they would have any physical impact, and they responded by saying it was undetermined. Clark County is working on a project called Project Orion, along with the cities, with the Secretary of State, and this is to upgrade Silver Flume. And this would alleviate, at least in my estimation, any expenses that the Secretary of State would incur, but I would certainly leave that to them if they'd like to testify on that. And just in close, examples of business licenses under general business include mobile food vendors, sidewalk vendors, business support services, repair handymen, cleaning services, and even healthcare providers, among many others. And with that, I stand ready for any questions.
Thank you very much. All right, questions, and I think Senator Neal has one.
Thank you, Madam Chair. So on the fiscal note, who did you say was undetermined? Was that Clark?
No, Senator, that, through you, Madam Chair, to Senator Neal. No, ma'am, that was undetermined was the Secretary of State.
Okay, so has the Clark County fiscal note been adjusted because it also said it was unable to determine the fiscal impact and there would be costs related to coordination between the regional jurisdictions, which was surprising because in the hearing, right, because clearly that this was already work that was going on, already coordination that was going on, and conversation. So has that been adjusted, or is that still the same?
On cue, Joanna Jacobs has come up to assist me. Thank you.
Joanna Jacob, on behalf of Clark County, through you, Chair, to Senator Neal. Yes, that we will adjust that. We've been working on multiple amendments to this bill, so the amendment that we presented to Senate Government Affairs, we will adjust that. It is, the intent here is to align with what we are doing right now. So, and that includes, in the last amendment that we did in Senate Government Affairs, I know that you had asked about this, is that we are trying to work regional with the local cities, and the Project Orion project that's ongoing with the Secretary of State's office. So we want to align with those technological projects that are going and the work that we have to do to support that effort. So certainly can communicate that, and of course it will be adjusted so accordingly. Thank you.
Okay, any additional questions? Senator Wynn.
Sorry, just to kind of echo some of those concerns. I don't know if there's anyone from the Secretary of State here, so I may have to follow in person. No, I don't see anyone. I know that we see in this committee like IT projects and the inability to make any kind of changes to coordinate with other systems. So I'm just concerned that an undetermined fiscal note might be like a multi-million-dollar fiscal note if they are trying to do this. So it's my understanding that this is mandatory. It's not enabling language. They would have to communicate with each other. Can I just clarify that?
John Steinbeck for the record. Yes, I do believe that is accurate. But the NRS statute that is referred to, it does state as soon as practicable. So I believe that would alleviate any issues that if the IT isn't in place yet, that they would have to wait until that does occur.
Okay, thanks. That actually helps out a lot. Thank you so much for that clarification.
Thank you very much. And I don't see any additional questions, so you can step back, sir. And we will call those in support here in Carson City.
Joanna Jacob for the record, Senator Don Darrow Loop. We are in support of this measure, having worked with Senator Steinbeck on multiple amendments to this bill and trying to recognize the good work that's going on in Clark County. Our Clark County business license has been working with the cities. Mr. Cathcart is here with me at the table, and we are hoping to make some progress on a multi-jurisdictional license and set a framework for this to be built upon in the years to come. Thank you.
Thank you, Chair, members of the committee. Mike Cathcart, representing the City of Henderson. I just want to clarify, adding the multi-jurisdictional to the shall at some point, when practicable, integrate with the Secretary of State's software, is really adding the multi-jurisdictional piece to that. That same language has been there for the cities and the counties in the South, and we're kind of adding the multi-jurisdictional as a standalone, that when we can do it at a reasonable cost, that we would move forward with that project. Thank you.
Seeing no one else here in Carson City, we'll go to Las Vegas. Seeing no one in Las Vegas, is there anyone on the phone lines in support? AVH, when you're ready.
To testify in support on SB 373, please press star 9 on your phone to take your place in the queue.
Hello, this is Peter Guzman, President of the Latin Chamber of Commerce. I want to say thank you to Senator Steinbeck for all his hard work in this measure. I think this is smart business, so the Latin Chamber of Commerce is in full support. Thank you.
Thank you very much. Next caller, please.
Chair, there are no more callers in support at this time.
Thank you very much. Those in opposition here in Carson City, Las Vegas, and on the phone lines, AVH, when you're ready, in opposition.
To testify in opposition, please press star 9 on your phone to take your place in the queue.
Hi, I'm actually not in opposition. I hit star 9 as you guys were talking, so it put me in this category. Can I go ahead and proceed?
Please, go ahead.
Thank you. I am in support of the bill for the regional jurisdiction. And I'm sorry, my name is Tammy Romo, Tamiromo. I hope it also promotes the small businesses to grow within our state and our cities, and we help them in any which way we can. I support the bill. Thank you.
Thank you very much. AVH, are there any other callers in opposition?
If you'd like to testify in opposition, please press star 9 on your phone to take your place in the queue.
Hi, Catherine Ivanov, Ivanoff. I am also in support, but wasn't able, I don't know, I pressed star and I don't know what happened. Can I continue?
Please go ahead.
If you can put me in support. Just I want everything for small businesses to be as easy as possible, and the SOS website is not very easy to maneuver. I've been trying for a long time. Just please vote yes.
AVH, are there any other callers on the line?
There are no more callers at this time.
Thank you very much. And then we'll go to neutral here in Carson City, in Las Vegas, and on the phone lines. Neutral for Senate Bill 373.
There are no callers in neutral at this time.
Thank you very much. Any closing comments, Senator? All righty. You are excused. Thank you very much. We'll close the hearing on Senate Bill 373, and we'll open the hearing on Senate Bill 207. Senator Taylor, you are up last but not least. And we will welcome Governor List to the table. Thank you very much, sir, for serving our state as governor, and thank you for being here today and waiting through this whole long meeting.
My pleasure.
Thank you for being here, sir. All right, and with that, Senator Taylor, I'm sorry I stole your thunder, but
it's okay, you're the chair.
I've been around long enough to know Governor List, so it's my pleasure to introduce him.
Well, I'm honored to have him here. Good morning, Madam Chair and members of the Finance Committee. Thank you for having us here and to present this bill. My name is Senator Angie Taylor, and I proudly represent Senate District 15 in Northern Nevada, and I am here along with Governor List to present Senate Bill 207. Senate Bill, I realize first that I'm between you and having a break, so we're going to go ahead and expedite this, right? Senate Bill 207 requires the establishment of a program for all-inclusive care for the elderly, otherwise known as a PACE program. The PACE program is already currently in 30 states, serving over 80,000 seniors daily with medical, social, behavioral, and health needs. There is an amendment that was distributed to you. You should all have it. It's the last amendment page. It's there. In that amendment, you see an adjustment to the fiscal note based upon changing the bill so that we are able to charge an administrative fee, which is common in other states, to help minimize the cost. So as you can see from the number, we're able to get it down to about $250,000. And this is one-shot money. Once the program is established, according to Administrator Weeks, then the program should be self-sustaining. The governor has been with me along the way in this and has a little bit of experience with this program. So, Governor, would you mind?
Not at all.
Madam Chair, with your permission.
Senator and Madam Chair, I represent Valor, which is a company that does operate PACE programs in both Oklahoma and Virginia. And I guess I should have spelled my name for the record. It's L-I-S-T. Our experience with it is that it has been a fantastic program from a fiscal standpoint to address that part for each of the jurisdictions where it operates. An entity that operates a PACE program essentially will invest something on the order of $10 million in pre-opening costs to establish it. Nevada would probably have 2 or 3 PACE programs, so you're talking multiple tens of millions of dollars in upfront costs that are put into the economy. And I think even more important, over a long term, they have a significant operating cost that over a 5-year period, typically around $50 million pumped back into the economy. And from a fiscal standpoint for the state, it saves money because it diverts people who don't want to be in a nursing home environment to be able to have at-home care. And it saves about $25,000 per year for each participant for the state of Nevada that would be residing at home as opposed to in a nursing home. So $25,000 per person, and you multiply that by the hundreds of people in Nevada, saves the state itself significant millions of dollars. So we urge you to move forward and approve this and override the fiscal note.
Go ahead, please.
I just wanted to thank you, Madam Chair. Angie Taylor, Senate District 15 for the record. Just wanted to update, the updated fiscal note is a one-time cost of $225,000. Thank you, Madam Chair, for the opportunity, and we stand ready to answer any questions.
Thank you very much. And are there any questions? I think I have one, but go ahead, Senator Titus.
Thank you, Madam Chair. Thank you both for bringing this forward. There's no doubt in my mind that keeping a patient in their own home does save money. How does that $50 million, where's that created? Are they billing Medicaid? Are they billing Medicare? Where's that money coming from?
Thank you, Senator Titus. Angie Taylor, Senate District 15. I'm going to say yes. The billing is to Medicaid. That's the bulk of them. There is, I have the number here somewhere, there's a small percentage that is just Medicare, but the vast majority of recipients are actually Medicare and Medicaid.
Thank you very much. And I have a question, and only because I did the Place for Mom bill, and so I'm just curious that how elderly or people in need of this service would find out about that.
Angie Taylor, Senate District 15 for the record. Thank you, Madam Chair. How they would find out about this program? Because the program would be overseen by the new division, should we have the new division, of what's it, health, that one. Yeah, the new health authority. Thank you, Mr. Thornley. It will be overseen, and so as there are patients or citizens that are turning to them, looking to them for services and so on, then they'll be offered this opportunity to be involved. Again, it's one-stop shop, really. It's behavioral health. It's you can be at home, and you may even be in a nursing home. Most are. It's transportation. It's meals. It's all of this. It's really all-encompassing for those seniors who need it.
All right. Thank you very much for that information. Additional questions from the committee? All right. Not seeing any. Thank you again for being here, Governor. Thank you, Senator. And we'll go to those in support here in Carson City.
Good morning, Chair Dandara Lupin, the committee. I am Nancy Bowen, CEO for the Nevada Primary Care Association, representing the federally qualified health centers, and we are in support of this bill. Many of the health centers really do want to have a PACE program in our state. Thank you.
Good morning, Chair Dondero Loop and members of the committee. Again, Jennifer Lanahan, Lanahan, here on behalf of SCAN. SCAN provides Medicare Advantage plans in Nevada. We are in strong support of this bill. We think it'd be a great cost saver and provide wraparound services for the elderly. Thank you.
Thank you very much. Any additional support here in Carson City? Not seeing any. I'll go to Las Vegas. Not seeing any. On the phone lines, AVH, when you're ready.
To testify in support on SB 207, please press star 9 on your phone to take your place in the queue.
Hi, Chair and members of the committee. My name is Katrin Ivanov, IVAN, or Frank for the record. I'm in support of this bill. Not only I believe that it's cheaper when elderly are at home, but I also believe they thrive more and they're just happier, which makes them, I think they'll be healthier if they're at home versus a nursing home. So as I mentioned, elderly veterans, children is my soft spot. So please vote yes on this bill. We have to, none of us is getting any younger. We're going to have to use that bill soon. So let's make sure that we can spend more time at home with our loved ones. Thank you and have a lovely day.
Thank you very much. ABH, any additional support on the phone lines?
Chair, there are no more callers in support.
All right, thank you very much. Then we'll go to opposition here in Carson City. Seeing none, Las Vegas, we'll go to the phone lines. ABH, when you're ready, opposition.
To testify in opposition, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in opposition.
Thank you very much. We'll go to neutral here in Carson City, Las Vegas, and on the phone lines, ABH, when you're ready.
To testify in neutral, please press star 9 on your phone to take your place in the queue.
Good morning. This is Tammy Romo, Tamiro. I am going in neutral for this bill. I do believe that caring for the elderly is very important. And yes, being able to stay at home, it helps the elderly thrive. Being in a group home or a nursing home, I personally, my father just declined so quickly in that type of situation. So I do believe they need to be at home. I did hear that they were going to use Medicaid and Medicare monies. However, with Las Vegas being kind of like a senior citizen retirement place, I'm just wondering how far the monies will go. And then do they have to already be pre-qualified for Medicaid and Medicare before coming to Las Vegas? Or do they, if they already have it in another state, does that mean they'll automatically, they'll come here to live out their days or lives? I just don't know how the money goes. And I skimmed the bill very quickly and didn't see, other than the fiscal notes, I didn't see any other provisions made for the future if those numbers are doubled and we get more seniors that come to this town. So I'm going to go ahead and vote neutral on this bill.
Thank you very much. Any additional callers in neutral on the phone lines, ABH?
Chair, there are no more callers at this time.
Thank you very much. Closing comments, Senator Taylor. All right. Thank you again, Governor List, for being with us and gracing our halls. And with that, I will close the hearing on Senate Bill 207. And with that, members, we will go to some BDR introductions that we have received. So I'm going to go to Mr. Thorley and let him introduce those.
Thank you, Madam Chair. Wayne Thorley for the record, LCB Fiscal Analysis Division. The committee has 29 BDRs, which require committee introduction. So we received 22 yesterday, and then just this morning, another 7. They're all stacked over there if you'd like to look at them. 4 of the BDRs are budget implementation bills from the Governor's Finance Office that are required to implement the Governor's recommended budget. The other 25 are one-shot appropriation bills, which again were included in the Governor's recommended budget. I'll read off the BDR numbers just for the record. So what the motion will be for introduction includes these are the budget implementation bills: BDR 19-1149, 34-1160, 15-1121, and 18-1116. So those are the 4 budget implementation bill BDRs, and then the 25 one-shot appropriations are S1211, S1205, S1198, S1216, S1175, S1177, S1178, S1179, S1181, S1184, S1186, S1187, S1189,
S1190, S1191, S1193, S1197, S1202, S1207, S1208, S1210, S1212, S1218, S1221, and lastly, S1225. Happy to answer any questions if the committee members have any.
Thank you very much, Mr. Thorley. Any questions from the committee? Then I'll accept a motion and just a go ahead. No.
I would move to approve the introduction of the bills as read by Mr. Thornley.
Thank you very much. Second from Senator Titus. And before I call the vote, just a reminder that this is not in support of the actual bill. This is just a support to make these BDRs into a bill. Thank you very much. And with that, all those in favor say aye. Aye. All those opposed say nay. Motion carries, and the BDRs are introduced. Thank you very much, Mr. Thorley. With that, we'll go to public comment, our last item on the agenda for the day. And welcome, Mr. Irvin. Please go ahead when you are ready.
Kent Irvin, K-E-N-T-E-R-V-I-N for the Nevada Faculty Alliance. Pleased to see that one of our priority BDRs is moving forward relating to cost of living adjustments. We'll just see where that goes. But related to this morning's CPI report, it seemed that cost of inflation was moderating 2.3% year over year, but that covers up that for the first 4 months of this year, the inflation rate has been running at over 6% on an annualized basis. So we are seeing higher inflation that will definitely affect the cost of living for state employees. So please keep that in mind as we continue this process. Thank you.
Thank you very much. Any additional public comment here in Carson City? In Las Vegas? On the phone lines, AVH, when you're ready.
Participate in public comment, please press *9 on your phone to take your place in the queue. Chair, the public line is open and working. However, there are no callers at this time.
Thank you very much. And with that, we will see you all back in here tomorrow morning at 8 a.m. And with that, this meeting is adjourned.